I conquered IVIG, had to go to the ER anyways to get an x-ray of my feeding tube, and they found the explanation for the increase in GI symptoms I've been having lately. On our adventure.
Oh, you got freezing cold here.
Good Thursday morning. It's IVIG day. I was up again around 4:30ish, just sick. My stomach is still hurting quite a bit, but that vomiting spell has ended and I'm feeling like could be over for the day, which is nice. Usually they last like all night, so at least I got some rest before IVIG. Harlow is pushing her head into my stomach. The pressure helps with the pain, so just trying to pull myself together so we can head to the infusion center. Wow, I was wrong. I was not done puking, but I pushed an IV Zofran through my port, which I'm guessing they will use this today at the infusion center. I'm not sure what their protocols are, but the Zofran seems to have helped, thankfully. And I have a very comfortable outfit on today because I'm going to be at the infusion center for like 5 hours, they estimated. Need to be comfy. Harlow, you're looking good. She's got her flat vest on today because she's gonna have to hold like a 5-hour downstay, and I wanted her to be extra comfortable, so no pack. And I packed a bag with all the stuff she usually carries me and my hospital go bag just to be prepared for what might possibly happen. Not saying I'm gonna end up in the hospital, but like I said yesterday, it's better to be prepared. We are officially on the way. Got my mom here. Thank you, Mom, for taking me. So basically, just a quick recap, I'm getting IVIG today, intravenous immunoglobulin, basically giving my immune system what it needs to regulate itself more effectively and become stronger. If you want to learn more about IVIG, you can watch the immunodysfunction section of my chronic illness video. This is my second trial of IVIG. The first one I did a home infusion and ended up with anaphylaxis in the ER. And we suspect it was my pre-meds more so than the IVIG itself, but there's no real way to tell. If you want to learn more about my first IVIG experience, you can watch the beginning of yesterday's vlog. So yes, I am a little nervous because of my history with anaphylaxis with these treatments, but I don't want to let that fear consume me, so I'm going in ready to conquer this thing. Let's do this. We made it to the infusion center. Harlow has a nice little spot right here to lay down, and my mom got a coffee.
Got some coffee.
So we're just waiting to be hooked up. This place is so nice. I've got a warm blanket. I've got headphones if I want to watch and listen to the TV. I got a pillow. This chair reclines. They brought me some snacks, graham crackers and apple juice and peanut butter. Right now, I'm just hooked up to some saline, half a liter. I'm getting half a liter before and after the IVIG, so we're doing saline. Then we're gonna push my pre-meds. I think I have Benadryl and maybe a few other things. And then IVIG, and then saline again. That's gonna take about 45 minutes to run through. And then it's the IVIG. Harlow has made herself very comfortable in this perfect spot for her here. Through the window you can see birds in the tree, which is really nice, and that building back there is the hospital, so really close to the ER should I need it, but fingers crossed it's gonna go well. I found HGTV on the TV and Fixer Uppers on, so that makes me really happy, and I'm about halfway done with my saline. I just had my pre-meds of IV Benadryl. I can have IV Zofran if I need it for nausea, and we're still running my fluids. And it's time to upload the vlog, put it to public. Go, there we go. Ta-da, vlog is up from the infusion center. My mom is enjoying herself over there. We are about to start my IVIG. Fingers crossed and praying for no anaphylaxis. Well, I'm officially hooked up to my IVIG. I was so nervous when we first started it. I was shaking, but we're about 10, 20 minutes in now, and I feel fine. So I'm praying, fingers crossed, it's all going well so far. Harlow's doing well too. We're both doing well. Mom, are you nervous? I'm not so nervous anymore. They brought lunch. a sandwich and chips, and I didn't know they were gonna feed me so much here, so I brought my rice from yesterday, and they had a microwave to heat it up. So this place, they really care about the patients, and the staff is incredible. So anyways, I'm being bumped up in the rate. So we started really slow at 20 milliliters an hour with the IVIG, and every 30 minutes they take my vitals and bump it up. And I think my goal rate is around 125 milliliters an hour. So we're bumping it up slowly. We've bumped it up twice now, and things are still going well. I have this huge feeling of relief and not stressing anymore about having anaphylaxis, because I most likely would have had it by now. I mean, it's still possible, but I'm so grateful things are going well. We are over halfway with my IVIG. We have been bumping up the rates as needed. Starting to feel kind of exhausted and some body pains, but those are common side effects. Plus the Benadryl can make me sleepy too. Unfortunately, I've still been having the stomach pains that I've been having the past few days, but I managed to eat a little bit of rice and a graham cracker, which is good. And in even better news, Judd is on his way.
Jack's heart rate skyrocketed a little bit. Hippo alerted and they had to pause IVIG, but it looks like they're gonna resume soon, so.
Harlow was such a good dog. I sat up in my chair and was feeling physically exhausted. So then Harlow stood up and alerted me that I was going to pass out. So they checked my vitals and my heart rate was over 150. So it could be my POTS, it could be the IVIG making my POTS worse, it could just be the IVIG. So they paused the IVIG to be safe, even though I'm almost done with it. And they're running fluids now, had me lay flat. So when I become more stabilized, we're gonna try and finish the IVIG. I sat up, heart rate skyrocketed. Harlow told me I was going to pass out, so they paused the IVIG, had me lay flat, ran fluids. Then they, when I became stabilized, they gave me more IV Benadryl, and we're finishing the last bit of IVIG. And as you can see, Harlow has calmed down, so all is good.
Look at that. It's all done.
I officially finished my first IVIG infusion. Trial 2 was a success, with a minor hiccup, but still a success. IVIG, I did it. Oh my goodness. Like, when they first started running it, I was so nervous. Part of my brain was saying, don't let them run the IVIG, it gave you anaphylaxis. But the other part of my brain was saying, you gotta push through this. Thankfully, the latter won out, and we just had that one mishap where I had really bad tachycardia.
Yeah, mishap. It's just POTS doing what POTS does.
Yeah, I mean,
T part of the POTS.
Could be my POTS, or they said it could have been a reaction to the IVIG. It could have been lots of things, but I didn't even know I was gonna pass out. Harlow told me, and then they checked my heart rate and it was over 150. And because Harlow alerted, we were able to treat the syncope before it happened. And that's why I have her. She's an amazing dog. I'm so blessed. And I am blessed that I made it through without anaphylaxis. That's a big step in the right direction. But now we have to go to the ER anyway. Because I'm still having my stomach pains, and one of the things they said to look out for when I first got my feeding tube was severe stomach pains that last a while, because it could mean my feeding tube is displaced, since it like runs this long line through my intestines. With all my violent vomiting I've been doing, it could have displaced the feeding tube, it could kink it, so we've decided to play it safe and go to the ER for an x-ray to check it out. Well, checked into the ER. I mean, I can deal with the stomach pain, but when it goes on for so many days, you need to check to make sure the feeding tube is still in place. At least that's what they told me. So we're just gonna get an x-ray to make sure. And we decided to come to the ER, not urgent care, because we were right next to the hospital, and this is the hospital my GI practice is at. So if there is a problem, I'd be seeing my doctor. So I'm feeling like really physically exhausted. Not just sleepy from the Benadryl, but like wiped out. So we'll have to see how I feel over the next few days from the IVIG, because apparently you really see whatever side effects you're gonna get within the next few days following the infusion. But I'm just glad I made it through. That's a huge step in the right direction.
I'm proud of you.
Thank you, babe. And thank you for coming.
That's what I'm here for. Well, sitting here in the ER, Jack is getting fluids and some IV Zofran, and they're gonna do an x-ray of her stomach, see in fact the tube has flipped or not. And that's about it for now.
So I just came back from the x-ray. They just injected dye into my feeding tube, which made me even more crampy, but they're gonna look at it, make sure the feeding tube's in place. I think it's in place. I'm just dealing with pain that comes with my GI issues, but we want to be safe rather than sorry, so that's why we're checking. I am so proud of how Harlow's doing. She's had a very long working day and she's been spectacular through all of it. And anytime anyone comes in, they're like, oh, I didn't even realize the dog was here, which is one of the best compliments I can get as a handler, because it means she's doing her job and helping me while being discreet and behaving. So I'm very, very proud of you. Thank you, Harlow.
We get to go home, but this tube is actually kinked a little bit at the insertion site, so just past my skin when it goes in, it's kinked a little bit, which could be causing my extra problems. And it's not totally kinked, so I can still run feeds, and the feeds are going into my jejunum, but that can cause some of the issues I've been having. But the good news is we're changing this tube on the 18th for the GJ button, so that's how you fix it. And since I'm already set up to have it changed and it's not completely prohibiting my feeds, I'm just gonna have to struggle a bit until the 18th, but that's fine with me because I don't want to be admitted. I want to go home. I conquered IVIG, had to go to the ER anyways to get an x-ray of my feeding tube, and they found the explanation for the increase in GI symptoms I've been having lately. So I'd say it was worth coming in for sure. You know, I mean, always rather safe than sorry, and now we know what's causing my problems, so we just got to fix it by changing out the tube. I am still like giddy with joy that I made it through the IVIG successfully. And then I go back in 3 weeks for my next infusion, still in the infusion center for safety. I felt so confident there and much more safe with this treatment. I think I always want to do IVIG at the infusion center. And there were people with masks like me, people with ports like me, people with walkers like me, and it was just nice to connect. I mean, some of y'all are chronically ill, and you know how nice it is to like connect with others. I connect with y'all, and it was nice to connect with other people today. So it was a good experience. And now Judd and I are both exhausted. I'm sure Harlow wants some downtime, so we're excited to go home. We are on the way home in...
Pick him up truck.
Yes.
A little messy.
That's okay. I'm so thankful we did not have to use the hospital bag, but it was good to be prepared. I am bummed that my tube is kinked and it's causing my extra stomach pains and GI issues, but I'm thankful we are changing it on the 18th. It's not an emergency kink, meaning I didn't have to change it right away because it's not leaking into my stomach. The feeds are still going into my jejunum, but the kink itself is just hitting the wrong places and causing pain. But I can, like I said, I can tolerate the pain. I'm just glad I can get my nutrition, and it's gonna be kind of difficult until we change the tube, but totally fine. And again, I have to say, I conquered IVIG! After a good day of some hard work, Harlow is celebrating with one of her favorite bones, a pig's foot. And yes, Harlow worked a lot today, but I wouldn't ask her to perform if she didn't enjoy what she did. She loves working. I am just hooking up to my nightly nutrition. I can't tolerate my goal rate, but I can tolerate a little something, which is better than nothing. But now we know all of the factors contributing to my GI symptoms. The kink in my feeding tube, which we fixed by replacing the feeding tube, which we're doing on the 18th, to a GJ button, which will have a G port for venting and draining. That'll help with my symptoms too. And we're gonna change my feeding tube formula because I don't seem to be tolerating this one very well anymore. And something I find kind of weird is that towards the end of my infusion and then a few hours afterwards, I was so wiped out. The lethargy was unbelievable. And now I'm not feeling so lethargic anymore. I don't feel energetic or anything, but that period of intense fatigue is not here anymore. So if that's all I have to deal with IVIG, I can totally do that. But I got a really low dose. I was supposed to start with 20 grams and I only got 10 today because we wanted to be careful. So maybe I got too little an amount to really see side effects. But my doctor said the side effects really come the following days after the infusion. And the other thing is, seeing results from IVIG can take months and even up to a year. And the first few months and up to a year can give you really brutal side effects. So my doctor said a lot of people don't stick with it because of that. So I know that no matter what, I need to see this through with IVIG because my doctor knows it's going to help me. It's really the only treatment for my immunodysfunction, and I've known so many people who said IVIG has really changed their life, so it'll be worth it to stick through with it. Maybe I won't have any side effects, and that would be incredible. And if I do, We will handle them to the best of our ability, and I'm just still so grateful I made it through this infusion. That is a huge blessing. So anyways, I'm gonna do my nightly breathing treatment and get ready for bed. Just running my feeds. You know, that kink also explains why the pump will sometimes alarm and say no outflow, meaning there's a blockage. When there's no blockage to be seen in the line, it's because of that darn kink. We are a happy family. We're so proud of you, Harlow. So today was a productive day. I really feel like we got all the pieces of why my GI symptoms have been so bad lately. The kink, not tolerating my current formula.
Choking.
Oh, sorry, Harlow, let me move my arm. And I also need a new feeding tube with the G-port so I can vent and drain my stomach. And babe.
What?
I conquered IVIG.
You did.
That is a huge blessing, and I'm not really feeling any side effects, so fingers crossed, we'll see.
Where are you going?
Harlow's crawling all over the bed. So anyways, with that happy news, we are gonna say goodnight, and thanks for joining us on our adventure.